Hi, my name is Dr. Manoj Mehta and I am an eye surgeon. And today I am going to talk to you about a subject that is pretty close to my heart, which is sprint catarrh, also known as vernal keratoconjunctivitis. Why it is close to my heart? Because it is the young children who suffer from this disease and are often unable to explain their symptoms to the parents. And the parents are quite unaware of the fact that it is something which is going to be with their children for a long time, and that it requires a continuous treatment and a continuous surveillance till the child is about 18 years of age. Sprint catarrh is common in young boys, but now we are also seeing that a large number of girls, a significant proportion of girls, are also getting sprint catarrh. And the reasons could be several, and environmental degradation is one of them. Now, the thing which brings the child to the clinic is when the child gets a red eye. But often what a child will not convey to the parents is extreme irritation, extreme itching, and a burning sensation which is associated with sprint catarrh. It is a seasonal allergy which peaks from February and stays till September. In winters, it reduces, but it does not completely disappear. And this tendency will stay till about 18 years of age, where about 95% of cases they spontaneously recover and the tendency to allergy goes away. But there are a few cases where the allergy can continue into the adult age as well. Oftentimes, this eye allergy is associated with skin allergies, with nasobronchial allergies, and also some allergy to some food items. The most important thing that the parents have to do is to understand that 50% of the treatment lies in managing the environment. And I often tell parents that there should not be any brooming of the house in front of when the child is present. You should use a wet mop to clean the floors. Do not do dusting with a dry cloth. Use a moist cloth and white things. Do not have heavy drapery in the child's room. Do not have heavy durries, because all this is going to attract a lot of fungal spores, mites, and biological products of mites like excreta. It becomes very difficult to exactly pinpoint why the child is allergic to a particular thing or to which thing the child is allergic. It is conjectured that there are certain microscopic mites in the environment and a child is normally allergic to these mites. But there is a wide array of things to which people are allergic, and when we say somebody is allergic to dust, we are talking of millions and millions of molecules and not any simple thing. And it is organic as well as inorganic. So my simple message is, don't try to look for what you are allergic to, but take precautions and also take treatment. The second thing in environmental management is to avoid exposure to ultraviolet light, and for that ultraviolet light absorbing sunglasses are the best. And also use a cap with a hood in summers to prevent extra sunlight from going into the eye and hurting. I often tell parents that they have to make sure that if a child is fond of swimming, that they use occluding glasses which occlude completely and do not allow chlorine to hurt the eye. Because all these allergies get aggravated with any toxic stimulation, be it chlorine, be it any other toxic fume, industrial fume, which can hurt. The treatment has to be almost continuous during the high seasons of allergy. We have to use anti-allergic medicines systemically also at times. Topical drops are available and they have to be continued for a long period of time. And during the periods of remission, we have to find a molecule which can be used to tide over the period, and we should start medication before the allergy period starts in order to suppress the allergy for a long period of time. Now we have seen cases where parents move from one doctor to another, and all in this merry-go-round, they end up actually not understanding that this disease is not going to get cured. So it's going to stay with the children till about 18 years of age. So till such times as the child, during this growing period, the child should be under surveillance of an ophthalmologist, and steroid drops, which are often given, should be given under direct supervision of a doctor and for a specified period of time only. So the message is that please bring all your young children for a regular eye examination, and if they have vernal keratoconjunctivitis, please make sure that you stay with your ophthalmologist and follow all the instructions. Thank you.